How successful is hair transplantation? I am a 50-year-old male. I have thin hair at the top, but have sufficient hair in the back and side. How successful is hair transplantation? Please answer in percentage. Should I go for it?
Thank you for your question. You've asked a question without submitting a photo, but you describe your situation very well. You're 50 years old, you're thinning on top, and you have what you describe as a decent amount of hair on the back and the sides. And you're asking how successful is hair transplant, and you'd like to know in terms of percentages. Well, I can certainly give you some guidance on how we have our consultations with patients like yourself in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice over 20 years in Manhattan and Long Island, and I'm the founder of TrichoStem Hair Regeneration Centers. This is based on a technology that we developed during hair transplantation to help maximize success. This is a non-surgical treatment for hair thinning for both men and women, and I'll go over that as part of this discussion. So, when you describe a scenario of thinning and you're at the age of 50, basically the question first is how good does your frontal hairline look? How stable, how slow has the progression been? It sounds like you're just being 50 years old that, and with the amount of hair that you have, that the progression, the onset was fairly later in life, and the progression has been slow. So then the question arises: is hair transplant your best option? Well, this is a question that we struggled with for many years until the past few. Basically, when somebody came with a desire to have more hair, and before we developed hair regeneration, hair transplantation was the only option. The challenge was, how much coverage can you achieve? And what would be the survivability of the grafts? In the hair transplant field, doctors often compete by stating numbers of grafts and then competing based on the cost per graft. However, in the end, a year later, it's really how many grafts survived and how much coverage do you have. Basically, the challenge with somebody with thinning hair is that you have existing hair. When hair grafts are placed, putting aside graft survivability, existing hair will shed permanently. A lot will. People often refer to this as collateral damage. At a certain point, there is a challenge in how much coverage you're able to achieve, because you're losing a certain percentage of your thinning hairs, and with the understanding that the thicker hairs that are from the permanent zone will give you a little bit better coverage. But in the end, the density becomes problematic. This is a question that basically, when I looked at our results, I realized that there was an opportunity. We developed a process called hair regeneration, and it's using a material called extracellular matrix combined with platelet-rich plasma. What was originally intention of this technology was to help the hair grafts heal better, and a side effect was that thinning hairs became thicker. Well, the decision point now in our practice is, if someone has reasonable density as evaluated not just by what we see with our naked eye but also by microscopy, then we actually tell people not to do a hair transplant, but to do hair regeneration. Why? With hair regeneration, we're able to stop the progression of hair loss. We're able to restore or reactivate hair that hasn't been growing. And we can induce hair that's thinning to shed and to allow for thicker hairs to grow in. I have observed that with hair regeneration, in the right candidate, the coverage effect can actually exceed 2 hair transplants. So timing is very, very important and is very much of an opportunity. When it comes, before anyone goes through a hair transplant in our practice, we first aim for stabilization. Even if they have advanced hair loss, we want to maximize stabilization as well as reactivation and regrowth. The limitation of hair regeneration is the number of salvageable hair follicles. So if somebody has a frontal hairline that's really receded, hair transplant is still a very good option. But if they have existing hair, I always recommend hair regeneration. So I think what you should do is first meet with doctors who have experience with this technology as well as with transplantation. I think you have to be cautious because in the hair transplant field, a lot of people are trying to offer something similar to this technology, but mainly they're trying to get you to do hair transplant. In our practice, what we have essentially done is almost eliminated the need for hair transplant for people who have thinning hair. Because the reality is, once they have good results with hair regeneration, they're typically satisfied and they don't move forward with any other surgical procedure. Now that's been our experience in our practice, and we treat people who come from all over the world with thinning hair, both men and women, with over 99% success rate using hair regeneration. In terms of answering the question in terms of percentages, there is always going to be a range, and it is very individual, so it's hard to give you exact numbers because you have to look at the context of the person's level of hair loss as well as the overall medical situation and the type of hair that's being transplanted. There's a lot of factors that contribute to survivability and maximization of outcome. Now, of course, in our situation, we actually just help people first with hair regeneration, and very often that's more than enough, and they avoid transplantation altogether. So I hope that was helpful. I wish you the best of luck, and thank you for your question.